Yeah, well, for men who have erectile dysfunction, if they say that they just with their girlfriend, they lose their, I keep on saying girlfriend, their wife, they lose their erection, but or boyfriend, they
because you'd lose it with your wife, but not with your girlfriend.
Exactly. So that's.
A buzzword that we hear more and more the older we get is your testosterone levels, increasing them or maintaining them. And I know the older we get, the tougher it is to maintain them without doing anything. So there's got to be a way to boost those levels. I mean, the three of you are pretty good experts at this. I think all guys our age want to know.
Well, from my experience, like I've seen, the men who come in and they're, out of shape, they smoke, they don't exercise. The instant they start training, they start getting more energy. There's this, they get more energy as well as like lifting weights. Lifting heavy weights has been proven to boost your testosterone as well as eating, a good healthy diet, like a higher plant-based diet. So I think that's...
As a side note, estrogen comes from testosterone and it's fat cells that convert it. Wow. So if you're, for a man who's heavier, they can have more conversion to estrogen and it upsets the balance of testosterone to estrogen. So you can have higher levels of estrogen. So when men come in with symptoms of testosterone, which we probably should talk about next, I test their testosterone levels, but I also test their estrogen levels.
Okay. So I think first thing we want to know is what exactly is testosterone and why is it so beneficial to a man to have that hormone be healthy at a healthy level?
Okay, so testosterone is the male hormone. It's involved in so many functions in our health. Obvious ones are sexual, but also our muscle, our thought process, our memory. So many things rely on it's not just testosterone, it's the balance of testosterone, it's estrogen. Estrogen is important in certain levels in men. So a lack of testosterone can cause so many symptoms. When people come in with many, often it comes undiagnosed, but obvious sexual ones are decreased sexual pleasure, decreased libido, sexual interest, erectile dysfunction. Those are the common ones. Fatigue, decreased motivation, drive, decreased mental thought process, cognitive process, foggy mind. So.
And Dr. Newman, do you test for it on an annual basis when you see your patients?
Yeah, so what a great question. Just to follow on what Dr. Steinberg had said earlier, so we think that after the age of 30, your testosterone level falls about 1 to 2% per year.
Wow.
Now that's the natural decline. And then of course there's a question on should we be supplementing it? Is it natural? Is it supposed to be like that or not? And another point that was raised is we often forget that testosterone actually comes originally from the cholesterol molecule. So as the cholesterol molecule gets metabolized, one of the breakdown products is testosterone. Wow. So from our point of view, it also helps us to think about when you supplement with testosterone, what are some of the downsides? So it might increase your cholesterol level. It might increase your blood pressure. Those two things help us to know that your heart attack risk also goes up.
Wow.
There might be a side effect on the testes.
That's actually in the midst of being disproven. So I think this is, and I think that's done actually a lot of harm for patients not to be treated, because this came from a study which was done about 10 years ago in the JAMA, the Journal of the American Medical Association, that there was a study showing that testosterone supplementation is bad for the heart. It was a completely false, erroneous study. Unfortunately, it had made it to CNN and New York Times and everywhere. And the testosterone experts of the world got together and wrote a big letter, and there was a little retraction of this article, but of course nobody heard that. Since then, there have been many studies that show, number one, men low in testosterone are at risk for heart disease. So they're at higher risk for heart disease. So the corollary to that is, if we give them testosterone, is that going to help them? Now, men, there has been some studies suggestive of that, so it may be actually beneficial. Think about it. When you're young and healthy, you don't have heart disease. When you're older and your testosterone levels are less, I mean, let's be honest, we were meant to spread our seeds and die at the age of 25. So, testosterone is useless when you're older because we didn't live when we were older. So as that declines, men die more. So it's possible that there's the actual reverse relationship, that maybe testosterone will be beneficial. And there's a major study going on now looking at that point, whether testosterone supplementation in men who are low. This doesn't mean for a guy whose testosterone is normal to get him super high. We just want to get you to the normal level. And will that actually be cardiac beneficial? This study's about 2 or 3 years away because it's a major study. And obviously for heart events, you have to study patients for many years. But I think that this may be about to whip around in the next 5 years.
So Dr. Steinberg's highlighting an important part of the controversy. Another part of the controversy is there's no gold standard yet established for testosterone levels worldwide. Like your hemoglobin level, we know when you're anemic here and we know when you're anemic in Africa. That's the same. So one is, what is the standard? How much do we supplement to? And part of the controversy, what Dr. Steinberg said, it's actually very true. Why does women's heart attack risk increase significantly after the menopause? Both men and women have estrogen and testosterone balance. But after the menopause, their estrogen level drops. So our thinking from the family medicine point of view is, now that you've had the testosterone in excess of the estrogen, after 50, their heart attack risk is actually the same as ours or more. But Dr. Steinberg is highlighting an important point. Could there be this other side that's coming?
Yeah,
in?
there's a lot.
You hear athletes, and you look at some of the actors, Sylvester Stallone and all this, and I've heard they do take a certain amount of testosterone that's regulated to help them.
We have to be clear on this conversation. We're not talking about someone, again, who's a normal testosterone, who wants to bulk up and get him high. We're talking about men who are clinically symptomatic from low testosterone levels, proven on blood tests to be in the lower range, whatever that range is, and replacing it. And there's a real stigma around it. But I try to get patients who come in worried about taking it, saying, look, think about thyroid disease, which is a hormone. Your thyroid is low, you're symptomatic, you're tired, whatever, and we give it to get you to a normal level. So that's what I'm advocating, is that these men who have symptoms, we look for it, and if they're low, we're trying to just get them to a normal level. Right. We're not trying to make Supermen.
Now, I have a question.
Actually,
I have a question.
Yeah.
Is this only is it only fixable by giving them some sort of medication or supplement, or is there a way to increase it naturally that can just and is it better to increase it naturally over using a quick fix again?
Well, Nick talked about muscle building, especially larger muscles like the ones in your leg. But it's not very clear in terms of the studies whether this does transiently boost your testosterone, but will this help you on the long term to raise and maintain the testosterone levels that'll give a clinical significant improvement in whatever your symptoms are. Yeah. So yes, there are some things that boost the testosterone, but is there any magic diet or pill that's going to really, get you to that higher level?
You mean consistently?
Consistently and to the point.
Post-workout, you can feel.
You can feel, exactly.
You can feel that you're
right, but that doesn't mean that tomorrow night when you're with your girlfriend that you're going to have that testosterone and,
Well, who have you been talking to?
Your girlfriend.
But I feel like, right after a workout, I feel that's when my testosterone level is the highest.
Yeah,
you can feel the change.
Yeah, you're looking in the mirror and we're,
Yeah, but I also think that might be a dangerous level to keep at all times as well.
Yeah.
Like I always go, wow, don't make any big decisions right after a workout or take any big phone calls right after a workout. Am I right?
Right.
And then
for real, you do actually do that?
Yeah, because you don't want to be at that level, barking orders at people on the phone, because you're just so.
But there is variation throughout the day. Your testosterone levels are actually higher in the morning, believe it or not, and then they drop in the afternoon.
Right.
And
is that why you wake up with?
With your girlfriend?
No, but is that why guys have, or is it just psychological?
It's a good question.
Sorry, don't know.
Yeah.
About it.
No, but you wake up with
hard on.
Yeah. I don't know if there's any studies on that.
I don't know why.
But that's a good sign, right?
Yes.
You're healthy.
Yeah, that you're healthy.
That's a good sign.
Yeah, definitely.
For men who have erectile dysfunction, if they say that they just with their girlfriend, they lose their, I keep on saying girlfriend, their wife, they lose their erection, but or boyfriend.
Yeah.
They
Because you'd lose it with your wife, but not with your girlfriend.
exactly. So that's so if they have good morning erections, then likely the cause is psychogenic.
Or they had a crazy ass dream.
But that's what he's saying is it means that it's a psychological reason
Yeah,
and not a
unlike the
physical
organic.
one. Yeah,
I guess that's a good way for people to
that
know.
a way to test it.
Yeah. They used actually there was a test. They used to do nocturnal penile tumescence. They used to put a little wrap around your penis, and they used to measure how many erections you get during the night.
Wow. Is there a home test that we could do?
Yeah.
So can we highlight again for the audience
Just for
that
fun.
there's a difference between what we're talking about supplementing in low testosterone versus the average
Yes.
person. So that was an incredible point that Dr. Steinberg brought up. As a family doctor, the vast majority of patients that we're going to see have normal testosterone levels. So when we're counseling them, we're telling them some of the things that Nick was saying. They're all tired, they're all a bit sluggish. Dr. Uman, why isn't my testosterone? Well, we talk to them about exercise, diet, stress management, social life, sometimes some other medications to control your risk factors. From Dr. Steinberg's urologic point of view, he's really seeing the ones with low testosterone, and there you're going to see some of the benefits.
I have a point on that actually, because you asked if they do testing. There's no recommendations now to do testing. However, I see a guy who's 40 and who's got some symptoms, and his testosterone is in the middle of the pack. So most people would say, okay, your testosterone is normal. But what was it 5 years ago?
Right.
Right?
What's the baseline?
Right.
Yeah.
So if your bioavailable testosterone, which ranges from 4 to 12, let's say, if you're at 7, most people would say normally you don't need anything. But if you're symptomatic, what if your testosterone was 12 5 years ago? So I think that there's good to get a baseline every year, 5 years, whatever it is, to see the progression, because someone who's been at 7 their whole life may be different from someone who's come to 12 and is now at 7.
So is it something that should be checked every year?
It's a very good question. Just like when Sam said, we don't have a guideline for that. To Dr. Steinberg's point, everything else in family medicine we have a reference for, except testosterone. So maybe we should be doing it. We don't have a guideline. And on the other side, when we supplement, sometimes we supplement for women too. It could be creams, it could be injections. And that seems to have an important impact on their libido.
Testosterone, you're talking about
Testosterone,
yeah,
exactly.
Yeah.
On their libido, in a different sense, not so much on ours, but for other reasons.
Like what?
You mean for women?
Yeah. What's the?
It increases their libido.
Dramatically.
Sex drive, dramatically.
Yeah, but there's no guidelines about it, about
Exactly.
testing women in normal ranges.
No, still no guidelines.
Yeah, which is unfortunate, because I think, like men, there are probably a lot of women who are suffering from horrible libido, lack of orgasms, that maybe testosterone could a little boost. Obviously, we don't get them to men level, but that probably testosterone supplementation would help. This is not a sexist comment, but sometimes when they're
Say it,
actually-
Andrew, it's okay.
Watch
When
it.
they're performing-
Watch it.
Yeah. Cut.
We're gonna have a bunch of feminists are gonna come after us.